you?
Good, thank you.
That's good. So today we're going to go through our pre-screening session.
Okay.
So I've got a list of questions that I need to ask you, and then after that we'll go through and do like a bit of an exercise plan, or going forward what we need to work on. So what was your full name?
Samantha Woolen, W-2-O-L-A-N.
Yeah, and your date of birth?
8th of the 10th, 92.
1992. And
Female.
so this is the exercise, the pre-screen that Fitness Australia uses. So I'm going to use this template because it's really good and it asks all the questions that we'll figure out if there's any other health conditions that we need to look into further.
Okay.
So has a medical practitioner ever told you that you have a heart condition, or have you ever suffered a stroke?
No.
Neither? No. Do you ever experience unexplained pain or discomfort in your chest whilst exercising or at rest?
No.
No. No heart problems. Do you ever feel faint, dizzy or lose balance during physical activity?
No.
No. Have you ever had an asthma attack that requires immediate medical
No.
attention? No. No history of asthma?
No.
No. No asthma. Do you have diabetes type 1 or type 2?
No.
No. Do you have any other conditions that may require special consideration during exercise?
I have hurt my shoulder in the past, but
Okay. So not a medical...
not a medical condition.
Not medicals? No. Okay, cool. So we didn't answer yes to any questions. So at the moment we don't need any other allied health professionals, but going forward we'll have a look. Can you describe to me your physical activity that you're performing during the week at the moment?
Yep. So at the moment I have been playing a little bit of racquetball.
Yeah, cool.
That's probably once a week.
Yeah.
Apart from that, I just go for a couple of walks with the dogs, and that's about it.
Yeah. Racket, how do we spell that? Well, once a week. And what, would you go for a walk twice a week?
Yeah, probably twice a week.
Yeah, 2 walks a week with dogs. So is it quite leisurely?
It is a little bit, and then we might pick up the pace a little bit.
Yeah, cool, awesome. And about how long do they go for?
Probably half an hour or so.
Yep, 30 minutes. And how long does a game of racquetball go for?
20 minutes.
Yep, oh, nice and quick. Okay, so what would you say the intensity is of your racquetball game? So a game of racquetball goes for about 20 minutes.
Yep.
What would the intensity be if we had to rate it light, moderate, or like quite vigorous?
Probably moderate. I do get out of breath while I'm doing it.
Yeah, so a little bit shortness of breath.
Yeah.
That's good. That's how you want it to be.
Yep.
Yeah, good. So once a week, 2 30-minute walks. What sort of intensity are we looking at on the walks?
If I'm going with someone, it's more leisurely. I can still talk to them.
Yeah. Talking at the same time. Yeah.
But if it's just me and the dogs, I'd try to get them going to tire them out. So, yeah, bit not completely out of breath, but a bit short of breath.
So in between light to moderate.
Yeah.
Okay, that's good. Okay, so at the moment we're doing less than 150 minutes per week. So we probably just need to increase that volume. So that's what we're looking at today in this pre-screening as to where we're at and what we need to increase to improve your overall conditioning. Okay, so we'll come back to that bit. So this is just a bit of a model as to your heart rate zones, as to when you're, depending on what area you're working in, and what exercise you're doing as to where you want to be hitting what zones.
Okay.
Cardio or strength. Okay, so some more questions here is, what age group are you in? I could have worked it out from your birth year, but what age are you?
27.
27. Okay, so that's good. Any history of feeling heart disease?
No.
No? No. Do you smoke cigarettes?
No.
Very good. So moving on, so body composition, do you know how much you weigh?
About 121.
Yep. Cool. And your height?
I think I was 170.
Yeah, okay, so about 5'7", 5'8", something like that, 5'7" or so. Cool. So I'll be able to figure out your body mass index based on based on your weight divided by your height, and your waist circumference. Will be bigger than 80 centimeters. Okay, we can figure all that out. We'll come back to that. Okay, so the risk of chronic disease. Okay, have you been told that you got high blood pressure?
No.
No. And do you know your blood pressure readings?
No.
Is it pretty normal?
I think last time I had it done, it was normal for my weight.
Yeah. Okay. Yeah. So it might be slightly higher, but they would have told you if you have high blood pressure.
Yeah, they definitely
Okay,
say
and
that.
there's no medication if you don't have high blood pressure. And have you got high cholesterol?
Not that I've been told.
No. Okay, we can skip a few of these questions. At the end. Okay. High blood sugars? No. No chance of diabetes, or depending on weight and what's going on here, we might have to really look at increasing this exercise.
Yep.
No medications because no medical conditions. Have you spent any long durations of time in hospital for any condition, illness or injury?
No.
No. So have you been pregnant or given birth within the last 12 months?
No.
No kids?
No.
No kids. Okay. Do you have any diagnosed muscle, bone, tendon, ligament or joint problems?
They haven't been diagnosed, but I have had an injury in basketball where something with my shoulder.
Okay, yep. And have you had that looked at?
Yes, but they couldn't find anything, so it just gets tender when I run and swing the arm.
Okay, so was that seeing a doctor?
Yes.
Yep, so that was GP?
GP, yeah.
Okay, no worries at all. Cool, so that's our pre-screening questions. I think based off this, what we can look at is this injury. Let's start with the injury. So a shoulder injury, about how long ago?
2 years?
Yep. Never saw a physio?
No.
No physio. Okay, GP, didn't have any scans or anything? No scans, that's okay. A lot of the time scans don't reflect your pain or what's going on anyway, so that's okay. So no scans, no physio, just which shoulder?
Right.
Right shoulder. Okay. Exercise wise, what goals have we got?
I'd like to do like a stadium stomp into the MCG.
Yeah, so some stairs.
Yep.
Ooh, great goal.
Yep.
Stadium. Okay. So that's quite a bit of cardio endurance.
Yep.
A lot of leg strength.
Yep.
Leg cardio as well. Or general cardio. And strength as well. Okay. Is this, so as a bit of a SMART goal, so it needs to be specific, that's quite specific.
Yep.
Measurable, we need a time frame, so have we got a...
It's usually in June, so it's about 8 months.
8 months or so, yep. And that's quite attainable to be able to complete that within an 8 month time frame. Yep, beautiful, and yep, that's awesome, that's easy. Okay, so what we need to look at here is if this is your general goal, we probably need to look at a little bit of losing some body fat as such.
Yep.
Measurements are a really good way of measuring that rather than just looking at the weight as a whole. We've got to look at body fat. So that's easy. So how long would you want to spend in the gym at a time?
Well, I do work full time, so ideally with the racquetball, like maybe 2 to 3 gym sessions.
Yeah, and how long?
I don't know, half an hour?
Yeah, half an hour. Yep. 3 30-minute sessions a week. Yep. Plus 30 minutes of racquetball and an hour of taking the dogs for a walk. Yep, that's really good. Okay, moving on to paint. Right. Is there any exercises you don't like to do?
I'm not a big fan of burpees.
Yep, that jumping movement. Yep.
Yeah. And because I can't exactly do push-ups, so
yep.
that whole getting myself
up
back
and
up
down.
quick.
Yeah, okay. Yep. So push-ups are a struggle. So
Yeah.
generally what's hard for us is things that we need to do to improve on.
Yep.
So, it could be a progression that we start off with something, and then we progress to, like, we start off with a bit of a chest press, and then we progress to like a kneeling push-up, and then that way you develop that chest strength of being able to push your body up.
Yep.
And then you're adding that cardio component of it to the burpee and the up and the down.
Okay.
You didn't have problems with blood pressure or anything like that, so sometimes you can get that bit of dizziness from the up and down movement, but it's a bit of a trial and error, and if you get it, then we just pull it back or slow it down as such.
Okay.
Yeah, so that's just a bit of a progression. We start with the chest exercise, and then we can go to push-ups to burpees.
Okay.
Depending on how you feel and how you feel within the gym. So that's no worries. Cardio equipment wise, like obviously if you want to achieve doing a stair climb, the Stairmaster, would you be happy to get on that? Yeah. That's a great bit of equipment, really burns you out cardio wise quite quickly, but that fatigue kicks in, and sooner enough, the more you do it, you'll be able to go for a longer duration before that same amount of fatigue kicks in. So that's what you want to be able to achieve.
Yeah.
Especially with a stadium stomp, it's quite an endurance exercise. You're going up, and then you have to come back down. So there's that different pressure on your legs, and then again you got to climb again. So those glutes need to be strong. The core and the quads need to be nice and strong as well. So you've got that power to keep getting up the stairs.
Yeah.
Oh, it's so funny.
I just had a moment. Go.
What else I need to ask? Okay. So we probably want to start with eliminate exercises that could increase your risk of injury. So obviously we want to help strengthen that shoulder and get that as strong as possible before we do start really loading it. So one way that you could do that would be, I could do a bit of a referral to a physio.
Okay.
And you could go and see the physio, get some basic shoulder strengthening exercises, get them happening, but at the same time, don't delay your gym exercise.
Yeah.
So you do those, you work on your shoulder strength with your physio, and we incorporate that into what you're doing within the gym. So we can always work together, a physio and myself, to get the most benefit for you within your gym program.
Yep.
So I can always refer off to the physio. So that's no worries at all, and that that way you're going to get the best out of it. You're not going to risk any injury or any further injury to your shoulder, depending on what's going on there. But it's not going to hold you back from trying to achieve your goals. So that's a really good idea. So I guess from here, I design your exercise program. I have a bit of a look through our pre-assessment questionnaire here. See if there's anything that I might find as a bit of a risk factor. I think things like your body mass index, it could be a case of that becoming a chronic disease such as like diabetes, or you get more shortness of breath and it puts more pressure on your breathing and your cardiopulmonary system. So they're just things we've got to look at. We've got to increase your endurance and your exercise tolerance so that we can help reduce those risk factors.
Okay.
So I'll just have a bit more of a look through this. When we have your exercise session plan, we can have a bit more of a chat, see how you've gone with the referral with the physio. There could be another referral to exercise physiology of someone that specialises in chronic disease. So if that become a bit more of a concern to me, if your weight's not shifting and stuff like that, the more we get into it, that could be another referral process we just look at. Okay. They just look at exercise a bit differently, but it's not going to hinder your gym programming and trying to achieve your goals or better yourself and better your health. So that's okay. That's no worries there. Have you got any questions?
No, I think we've gone over everything, which is very good. I'm looking forward to the plan that you make.
Yeah, cool. Yeah, and I'll just get that referral off to physio so we can get your shoulder under control and that way you'll be able to do burpees in no time.
Look forward to it.
Yeah, great. All right, well, we'll catch up soon.
All right, thank you.
Wonderful.